I would like to welcome you all to today's workshop, COVID vaccines, motivational interviewing, and AOD clients. My name is Julia, and I'm a project officer here at VADA. To begin, I acknowledge the Wurundjeri people as the traditional owners of the land on which I reside, and pay respect to elders past, present, and emerging. And I'd also like to acknowledge that this land was never ceded. And at this time, I also welcome you to, in the chat, introduce yourselves and the land on which you're meeting from. Today's interactive workshop will seek to explore the connections between motivational interviewing strategies, COVID-19 vaccination uptake, and AOD clients, provide an overview of some of the resources available to reduce barriers to access for clients, and opportunities to collaborate and brainstorm in small groups with colleagues. The presentations included in today's workshop will be recorded. However, the breakout sessions and all chat in the chat box will not be captured in this recording. Facilitating today's workshop today, I have the pleasure of introducing Helen Mentha of Mentha Consulting. Helen is a clinical psychologist who worked in the AOD sector for 13 years prior to specializing in M&I training. And without further ado, I will pass over to you, Helen.
Thank you very much. So hi, I'm Helen. I would also like to acknowledge the lands that we're all on. I'm on the lands of the Wurundjeri people of the Kulin Nation. I'd like to pay respects to elders past, present and emerging, and extend a very warm welcome to anyone of Aboriginal or Torres Strait Islander descent who is with us today. So just to, I guess, give a little context of what are we going to cover for the next 50 or so minutes or hour or so for my section. Just really being curious, what might MI offer in conversations about vaccines? So this is not a script of this is what will work, this is what's going to work, this is what you should do. It's more, let's just be curious to go, we know motivational interviewing can help us out in a whole range of difficult conversations where people have very mixed feelings about change. Let's just see what it has to offer. But just to get started, it'd be good to hear in the chat, what are some of the difficulties that you're experiencing talking with people about getting vaccinated? What brings you here to a webinar like this? So what are you noticing? Where are the sticking points? Where's the friction? What are some of the challenges? So maybe just include some of them in the chat. Just gives me a sense of what you're dealing with. So I've got in the chat just the level of medical advice, misinformation. Is really hard for people to sort that out. What is the truth? What sense do they make of that? So fear of the unknown. Then concerns about, well, what do the protests mean? Ranging from just mixed feelings, ambivalence, through to misinformation, or maybe just having a different understanding of vaccines than we might have. You might have, and what constitutes genuine research and the level of information that is out there, and lack of trust, like what's in it, is it safe? Mistrust of the government, and we're often talking about a part of the population's got some very good reasons to have mistrust of the government, or feeling that maybe people aren't on their side, and getting stuck in conversations about political agendas. Yeah, so other views are starting to come into that conversation. It's not just about the vaccine, it's not just about COVID. So what are your hopes for the webinar today? So what made you decide to put this morning aside? What are you hoping to cover in the webinar? Or what are you hoping to get from this? We may or may not be able to meet it, but it's always good to get a sense of what you're looking for. What are you hoping for? So one of the other concerns is when they've got real world examples of maybe someone had a bad experience of vaccine side effects, wanting to have honest and respectful conversations. So we don't want to skirt around issues, but we also want to make sure they're sensitive, thoughtful, respectful exchanges. What else? What else are you hoping for? Lovely. Yeah, helping people to find the decision that's right for them, that they're comfortable with, that they can live with. And a lot of decisions in our life, the one thing we don't have is access to how it's going to turn out. So we need to be able to be comfortable with the choices that we're making. And removing the self from decision making. Lovely. So let's get into it, and let's just think about what MI can offer as a framework. So we've just had a little bit of a check-in, so thank you very much for that. So what is MI offering? And I think one thing people really like about MI is that it's coming from a set of values, which is how we want to be working already. And it just gives us some practical ways to have the kind of conversations we're already hoping to have, that we want to work in equal partnership with people. And we're hoping that the conversations go somewhere helpful, that we leave people better than we found them. And it's respectful, it's client-centered. It offers some strategies to deal with some of these common challenges in change conversations of the friction, mixed feelings, building motivation, moving into commitment. And then we know commitment to action is another big step in the change process. And I think one thing people appreciate about MI is that there are some simple techniques. So hopefully even if you've never met MI before and this is your first introduction, there may be some practical ideas that you could put into place. And 20 years later of learning MI, there's still more depth. I am definitely still learning, and I would have first met MI 23, 24 years ago. And I like that. It feels like a good investment. So the core ingredients of MI, I think, again, one thing people like about MI is it's not that complex, it's not that complicated, because if you're in the middle of a difficult conversation, you do not want to be remembering something that's really complex with lots of moving parts, that we've got a relationship that we want to form with people, some core skills. There's 4 processes that we can attend to across the change conversation. And increasingly, when it becomes more its own form, when it really moves into MI, it's about facilitating positive change that's meaningful for that person. So another way of kind of, I guess, breaking it down is to think, what are the domains in which MI can help us in our conversation? So one is this way of being. How do we turn up as a person? How are we in our half of the relationship, and how do we engage with people? And ideally, this is one of those things that we don't turn on and off. This is a way of thinking about the work, full stop. Then there's a way of listening, of tuning in. How are we paying attention to this person in front of us? Then there's some core skills that we can use. How are we communicating? What's actually coming out of our mouth? And then what do we do with what we're hearing? How do we respond to what people are telling us in a thoughtful way? So let's start with the spirit. So I want you to just think about, how would you want someone to talk to you if you knew that they had a concern about your behavior, and maybe you had a sense they really want you to change it, and you might not be so sure? What qualities would you want? And again, this might be one just to pop into the chat. If someone were to talk to you about a behavior of yours that they're concerned about, that they're maybe hoping that you might be able to change or approach differently, what qualities would you want that person to have, and how would you want to feel talking with them? So we've got humble, non-judgmental, open-minded, compassionate, understanding. Now, those are beautiful qualities of an equal, a peer, not someone who is seeing themselves as superior or knowing better. Empathy, so someone who's really wanting to understand what we're saying and curious about our perspective, our point of view. Curious, open to clarification. So this idea of understanding is a two-way street. They are not just there to give us their understanding. That you get a chance to talk about why you're seeing things the way that you are, or why you're doing things the way that you are. And a sense of respect. that you know yourself and you've got reasons for why you're thinking what you're thinking or doing what you're doing. And these are absolutely the same qualities that we want to bring to any conversation, particularly about something like vaccines. So if we think about how am I quantify some of those ideas that just came up in the chat, this idea of we are equals. It's just in this conversation, we have different roles. Our role is to provide a structure. Their role is to provide the content and see if we can help them take their own thinking further. And as was said before, our destination is to make a decision that they can live with, a truly informed choice that feels right for them. These are fundamentally compassionate conversations, and we only need to ask one question to get a sense of how important compassion is. Would you let your guard down with someone who has no compassion for you? It actually feels kind of unsafe, doesn't it? So we want to come from a place of genuine care and concern for this person. Acceptance that there is this openness to try and understand, and that we need to demonstrate that understanding. So that's the use of accurate empathy reflections, because what we've understood the person to tell us is of no value if they're not hearing it back in some form. They need to know what sense we're making of what they're telling us. And this idea of respecting autonomy. At the end of the day, it is not our life. It is theirs. And it's their right to make their own choices. And then evocation, that these are conversations where we're going fishing rather than fixing. We want to draw as much from the person as possible. And for me, I like to bring this back to core values, and particularly if I'm thinking about having difficult conversations, I am not going to remember anything complicated, but it's really hard for me to forget what my core values are that brought me into this work, that this is about treating people with respect. This is about having faith in people, that they do have a capacity to know what's right for them, that they've got a lot to bring here, and we want to find out what that is. Treating people with dignity, that we're treating people that we'd want in a way we'd want to be treated, or we want our loved ones to be treated. And that these are conversations coming from a place of curiosity. And then let's think about listening. Because that was a theme in what would you want from someone else if they had concerns about your behavior, that they were willing to listen, that they were open-minded, and they're willing to listen on a deep level, not just a superficial, right, yeah, gotcha. And yet we know, easier said than done, because our minds get full. You're working with many different people. So I'm just going to open up breakout rooms to have a quick conversation with each other. What is it that takes you away from listening? Just going to open up breakout rooms. I'm going to put another question in the broadcast function that comes up at the top partway through. But just thinking about when you're in conversations about vaccinations, what do you notice distracts you? What is it do you notice that maybe pulls you away into your own thoughts or your own reactions? And now you're less anchored in listening to that other person. So what takes you away from listening in conversations about vaccines? So just give you a couple of moments to talk about that. Then I'll put another question in the chat. All right. So again, very easiest is to use the chat function. It'd be really good to just get some responses. What did you share in your conversation? So what are some of the things that you notice take you away from listening? What gets in the way? What pulls away your attention? What did you find? What takes you away from listening? So if what someone's sharing feels really extreme or feels hard to believe, feels outlandish, more likely to be reactive rather than responsive. Activating my own views on vaccination, misinformation, the urge to correct or provide information because we've got that sitting there ready to go. A sense of obligation to the client, to the community. When you're having several of these conversations in a day, your own COVID fatigue, absolutely. So all of these things pulling our attention away. So what have you found brings you back to listening? This is the main event in good conversations. So what helps you return to listening? What have you found works for you? What kind of things have you noticed? Certainly for myself, coming back into my body, noticing things in the room, acknowledging, so we've got now acknowledging my own discomfort, taking a breath, again, tuning into the body, knowing your own energy, organizing for these conversations to be at a time of day when you're most likely to be present. Lovely. So that preempting. So when you know that you'll be a bit more topped up on patience, tolerance, space, and the feeling that there's time to talk. So that lovely magic trick that we all want from helpers and is such a lovely gift to offer someone else, you know, that sense of there's all the time in the world, even though we know there isn't. That lovely sense of space, no pressure. Debriefing with other colleagues, lovely, clearing the way for more conversations. Just that reminder to ourselves that clients have the right to their own opinions. Knowing that this is familiar stuff for us. So this isn't just about vaccines. We often have conversations where there's resistance or people have their own ideas, and using those skills we use elsewhere. Just that humility to go, I can't change everyone's mind, and I don't need to, and I don't need to save everyone. Just kind of owning our side of it, not feeling that pressure to be more than is reasonable, and coming back to curiosity. And coming back to this idea, there's a whole range of reasons. There's that again, coming back to openness and curiosity. Certainly for myself, I know that sometimes it's what you do in the 5 minutes before the conversation that can make the biggest difference. Just really coming back to your intention. How do I want to be with this person today? Because in MI, we often get comfortable asking, how ready is this person for change? We don't as often stop to ask ourselves, how ready am I for this person? Or how ready am I for this conversation? How can we be more present? So let's now think about core skills and what might they offer. And if you've met MI before, you'd be very familiar with the acronym of OARS. Open questions, affirming, reflection, summaries. But I think if we were to look at what might be a more complete skill set, we might want to add listening as a learnable, trainable skill, but we also might want to add refrain, the skill of what we don't do, what we don't say, what we don't do with our behavior. We know from our own experience that someone might be saying the right words, but if their face kind of says they're not believing us, or they've got a little eye roll, or there's something, we shut right down. So just thinking about this idea of refrain, taking a moment, and if you've got a notepad next to you, just taking a minute or so to write down, what is it that you're busting to tell a client when you're having a vaccine conversation? What is it that's running through your mind? So just maybe jot a few keywords down. What are you wanting to tell them? What maybe are you wanting to explain? What maybe are you wanting to just blurt out? That if you weren't being your considered professional, responsive self, what is bursting in your mind? And also, what are your thoughts about the conversation? What are you feeling about the conversation? Maybe you've got your own ambivalence about having the conversation with a client. Is this my role? Maybe you've got your own ambivalence about vaccinations, mandates, some of the other things going on at the moment. You might have your own mixed feelings about that, or your own clear opinions about that. You may be having thoughts of family members, maybe dear loved ones in your life who are severely immune compromised, and the risk to them of people not being vaccinated. Maybe that's something that's burning in your mind. Certainly for myself, my parents are quite old. Dear friend is highly immune compromised. It's hard for me to put that aside. So just jotting down, what are you busting to say? And then whatever that you've written, that's yours. That's not the client's. So we need to have a relationship with our own stuff that keeps it on our side of the conversation. And ideally, what we're looking for is the client's blank page. And what is it that they might want to write on their page? What is it they might want to write on their page in favor of vaccinations? How do we discover what's on their list rather than what's on our list? So that idea of just owning it. Whatever you wrote on that list is yours. One of a little strategy that I've found quite helpful, someone that I'm maybe having challenges with, and I'm getting a little bit caught up in my own, they shouldn't this, they shouldn't that, we all get that, right? One of my little strategies is I think of a whiteboard and I write down everything I'm thinking that they're thinking or feeling, or what their intention is. And then when I look at what I wrote on my little imagined whiteboard, anything I wrote there came from me, and I've got to wipe it off because that came from me. And then sometimes I'm just going to start writing back on it again, and I might need to wipe it off again and again and again. And maybe the whiteboard's looking a little dirty by the end of it. But I find it a helpful strategy. If I've written it down, it's coming from me. So let's just watch a 2-minute clip. And this is from Bill Miller, just talking about why might we have conversations the way that we do in MI, and why might we want to be really thoughtful about our relationship with what we're thinking, what is going on for us in our half of the conversation. This one just goes for 2 minutes.
Well, Steve Rolnick and I have written about the writing reflex, which I think comes with being a helper. It comes with wanting to make a positive difference in people's lives. And when you see someone going down the wrong road, somewhere that's going to lead them to painful outcomes, you want to run around and get in front of them and say, stop, go back, don't you see? I mean, go this way instead. And it's just a natural outcome of that desire that draws us into helping, which is fine. But the problem is what happens when you do that with an ambivalent person. When you take responsibility for the change, when you say, this is a problem and here's what you need to do, you elicit from the client exactly the other side of the ambivalence, because they have both sides inside of them. And so they're then likely to say, well, it's not that bad, or I'm not sure I need to do that. And you wind up kind of acting out their ambivalence between the two of you, with you taking the good lines and you're leaving the more resistant or reluctant lines to the client. And that's not good, because we hear ourselves talk. And as I hear myself talk, I get committed to what I'm saying. So ironically, if you follow your helper instinct and try to advocate for and persuade and coax and cajole and coerce and confront people into changing, you can actually have the paradoxical effect of eliciting from them lots of resistance, which makes it less likely they're going to change. And so I think that those behaviors come out of the best of intentions and come from a heart of wanting to help. But we have to learn to suppress these. And after 20 years of practice, 25 years of practice of motivational interviewing, I still have to suppress my writing reflex and my desire to take up the good side of the argument. Now, because I know that's not the best thing to do, and instead to let the client make those arguments.
It's a nice way of putting it, isn't it? We want a conversation where the client gets the good lines. And yet how tempting it can be to take those good lines ourselves with the best intentions. So I think this quote really sums up what MI is about. I learn what I believe as I hear myself talk. So we want to be really thoughtful about, what am I inviting this person to talk more about next? What am I inviting them to hear come out of their own mouth rather than come out of our mouth? So now we can think about the core skill of reflection. So in MI, this is the skill. This is not just a skill. We want more reflections than questions. So this is where we reflect back what we believe the person is saying to us. So let's just work on that for a little. So this would be another great one, just to pull up the chat function. And let's just think through some possible statements that you might hear. Vaccination isn't a priority. There's too much going on. So let's just stop and think for a moment. What emotion might that person be feeling if this is what they're saying? What feelings might they have? So they might be feeling overwhelmed, that there's just too much, tired, lovely, stressed. It's got this real sense of maybe feeling pressured. So any of these would make lovely reflections. You're feeling overwhelmed at the moment. You're kind of tired. Your tank is running low. You've got a lot of stress going on. This feels like one more pressure. Now, what might be a strength in what they're saying? What personality trait or characteristic? What strength are they demonstrating in a statement like this? That they're doing a lot, lovely, that they've got a real sense of commitment to their priorities. You take your commitment seriously. It's important for you to prioritize. You want to discern what's important, what's not important for you. Lovely. What might they be concerned about if this is what they're saying? What might be going against change or getting vaccinated? What might they be worried about? So maybe concerned about side effects, that maybe concern, you see, maybe you got a concern that the vaccine might put you off track on these other things. It might take too long to recover from the vaccine. That once they have it, they can't take it back. So what else might they be concerned about? Perhaps that they're not able to attend those other priorities. You're worried about neglecting your kids. You're worried about not being able to meet those other obligations if you make time for this. What might their hope be if this is what they're saying? So again, might be a concern for long-term impact. What might they be hoping? Like if what's going in favor of change in a statement like this? What might make you feel more hope yourself in what they're saying? Oh, that they haven't shut it down. So there's something about, okay, so the idea of vaccination is still being considered. That if it were a priority, then it might get more attention. That they are open, that they are maybe actually open or willing to do it when it feels possible. So there may be something here as a hope that if they were to get the vaccine, it's not going to be a drama. It's not going to take a lot of effort. It's going to be something that they can fit within those other priorities rather than not. Now, double-sided reflection, a really nice way to form one of them, put one of those concerns first, connect with and, then put one of those hopes. So you're worried that this will take you away from other priorities. So if you were to get the vaccination, It's about fitting this in amongst everything else rather than competing with everything else. What about, and this is a theme that's already come up, I've heard too many things, different things about vaccines. It's hard to know who to trust. How might they be feeling? What might be an emotion word there? Fearful. What else? Confused. Absolutely. Worried. Unsure. So yeah, you're feeling unsure about this. This feels worrying. Feeling let down, that they're not maybe feeling like they're getting the full story from someone. Lovely. You're feeling let down. There's too many competing views out there. What might be a strength in what they're saying? What personal quality or characteristic are they demonstrating in a statement like this? That they want the right answer. Lovely. There's something here about there's a need, that they really want a need for trust, that there's an open-mindedness. They're not going to take one thing on face value. They want to really consider their decision. They're taking a very thoughtful approach. They're willing to take multiple points of view into consideration. Lovely. And all of them make beautiful reflections. Yeah, you're really wanting to take as much of that on board to make the right decision for you. It's important for you to make a considered decision here. You care about your health. You don't want to take this decision lightly. Lovely. What might they be concerned about in a statement like this? What might be going against change, or what might they be worried about? There's a lovely one there about they're willing to hear from diverse opinions. Lovely. So what might they be concerned about? What might they be worried about if this is what they're saying? Worried about their health. Lovely. Worried about making the wrong decision. You know, you're concerned you might make the wrong decision. You want to do what's right for your health. You don't want to make an assumption. You don't want to jump to a conclusion. You're worried you're getting the wrong information. You're wondering whether you can trust all the sources of information you're getting. You're worried about the unknown. Lovely. Now, what might they be hoping for? What might give you hope in what they're saying? What might be going in favor of change? Seeking truth and clarity. Lovely. You're concerned about making the wrong decision, and you really want to know the facts. You're hearing such wildly different opinions, and you'd really like to get more clarity before you make a decision. You're getting views from a wide range, and you are open to information. Lovely. So now our double-sided reflection, we're just combining them. You're concerned you'll get it wrong, and you really want to make the right choice. You want to make the choice that's right for you. What about this one? It's not a big deal. If I get COVID, I'll be fine. So again, what feeling might there be? What emotion might be behind a statement like that? There's other worries, there's other bigger worries for them. This is not a big deal. They're not that bothered. There may be fear. Sometimes that can be that bravado kind of statement, some acceptance, confidence, ease, calm, lovely. Yeah, so you're not too fussed about this. What about a strength? What are we hearing as a strength? That there is a confidence. That they're willing to take a easygoing approach. That they're not getting overly stressed. What's another strength? Maybe that they're optimistic. That they feel they have done research. That they have been proactive in looking for information. What might they be concerned about if this is what they're saying? What might they be worried about? Being judged. Lovely. What else? There could be a bigger concern underneath. Fear around vaccination. Lovely. So it might be the concern here is that it's kind of overkill or it's unnecessary, and maybe the vaccine will be worse. Actively taking a vaccine is opening up risk, whereas maybe they feel like waiting and hoping and seeing how COVID goes isn't such a big risk. Feeling forced when they want to make their own mind up. Lovely. What might their hope be? What do you think they're really wanting here? Perhaps there's a hope that they'll be fine. They will be okay. They actually want to be healthy. So you're wondering if it's such a big deal and you really do want to be healthy. You do want to be okay. So there's our double-sided reflection. So then if we're thinking about the skills, our open questions can become so helpful if we're thinking to provide information or advice. And in MI, information and advice is presented as a skillful exchange. It is not a one-way street, which means ask, offer, ask is one of our best friends, best tools in conversations like this, because first we want to ask what they know. And ideally, that's a whole conversation. Then we want to seek permission to offer what we're thinking, what we know, our ideas, because people are just more open to information that they agreed to hear than information that just kind of came flying at them. And you know this for yourself, there's a big difference if someone just out of the blue gives you advice versus they give you advice because you said, I'd really love to hear what you think about this. Seeking permission is such an important, respectful skill to have. And then asking what they made of it. Ask, offer, ask. So then let's pull this together in terms of a way of responding. 4 processes in the change conversation. So we can then attend to where are we in the conversation? What might we want to do next? So first we want to engage. We want to feel like we're comfortable enough together to have this kind of conversation. Then we want to get a shared sense of focus or purpose. What is this really about? And that's a focus that they can connect with, not just our agenda or our focus. We want to then evoke those good lines. We want to hear from them what's their case for change, what are their reasons, what's their meaning, what's their momentum. Draw it out from them. And then planning belongs at the end like a good dessert. So in terms of the questions that we might ask, we want to start with things like, how are you? Who are you? And what are you concerned about? What matters to you? Getting a sense of what their priorities are. And it might not be vaccines, it might be something else. How might getting the vaccine help them to meet their needs? And then what might a next step be? And what we're looking for is just to explore. So in terms of ambivalence, we want to get a sense of what is it that's going for and against change, sustain talk, change talk. What is it that's pulling them in those different directions? About the vaccines, there may be concerns about risks, side effects, information that they've heard. And one of the things that MI can sometimes be presented as MI as a way of resolving ambivalence, whereas I think I've come to a point now where I think of MI as a way of helping people to experience their ambivalence. Because often when we're going around in circles in our own head, the easiest thing to do is just to shut it down. So really helping people to sit with what are they weighing up, which is a little different from discord. And that might be that their reservations are more about us or the system, feeling forced, feeling pressured, feeling criticized, feeling corrected, feeling labeled, feeling judged. So just being curious about where is the concern coming from. And then I'm just going to present, and this will be, I'll give you the handout. So this is just giving some possible wording to the kind of conversations that we might have. In terms of engaging, we want to make sure that we have good engagement before we go into a difficult conversation. And then just engaging them in the dilemma. I'm wondering if we could have a quick conversation about where you're at with getting vaccinated. Exploring their perspective and concerns. And reflecting back the understanding that we've gained without judgment. It's just where they're coming from. Then in terms of focus, what's the main issue for you when it comes to deciding about the vaccine? What can I do to support you? What would be helpful? Also, we want to get a sense of how does this relate to what they do know, what they are sure really matters to them. We've talked about how important X, for example, your family is, your kids to you. I was wondering if we could also talk a little about how vaccines might fit into your options there. Evoking, what's your understanding about how vaccines might help? Let's say you did get the vaccine. What might be good about that? What might become easier? What might be less of a worry? How might getting vaccinated fit with their key priorities? How might being vaccinated help you in looking after your kids? Or how might having the vaccine certificate reduce stress in your life? If we're still thinking, oh, I've got another idea or two that feels really relevant based on what I know about this person and feels like a reasonable thing to want to share, then maybe we seek permission to offer, or just us having another thought of how the vaccine might be helpful to you. Would it be okay if I share it with you? And really what we're looking for is we want to build up their why first. Because getting into the how and the planning is of no value if the person doesn't have a good why. Why is this meaningful for them? What would be good about getting the vaccine? How else might it help them? How important is it? Then how might they go about it? Getting their ideas. And then those initial steps towards planning. What are you open to trying? What steps have you already taken or considered? What do you think you will do? So in planning, we might have on a scale of 0 to 10, how likely are you to get the vaccine? What might make it easier or increase your chance? What ideas have you had? What steps do you think might help make this work for you? Seeking permission to offer 1 or 2 suggestions if needed. And we're about to go into a section with some of the resources that are available that can help people in the planning stage if that's what they're open to doing. And then again, just checking where they're at now with no judgment. There is no wrong place for them to be. Giving advice is not illegal in MI. We just want it to be a last resort and preferably not. But if we do still feel I need to offer something, we want to first support the autonomy. At the end of the day, it is your body, it is your choice. And I'll respect whatever decision you decide to make. Would it be okay if I shared a thought on this? I'm concerned about you and what might happen if you get COVID. We know that unvaccinated people have compromised immune systems. We know that unvaccinated people with compromised immune systems are the most likely to get very sick or have long-term health problems. And if I can help support you, I'd like to. Then if you are dealing with strong vaccine resistance, and when we've run this before, people have talked about having conversations that get really heated. Maybe someone coming in and the feel is almost like looking for the argument, looking for something to challenge. And we just want to soften that and return to a conversation that will be helpful. One of our basic rules of thumb in this work is we do not want to create an allergy to helping professionals. If it's not a helpful conversation, let's find a helpful conversation that is worth having. And again, just respecting autonomy, leaving the door open, and then refocusing onto something that might be a better use of your time together that day. So these might be good questions to come back to at the end. So we're going to hear some options, and if people are open to vaccinations, things that can help make that more possible, reduce the stress, reduce the friction, and then we'll come back to where's that leave you? What are you thinking? And it would be really good to get some thoughts about what's been helpful from the webinar today. So handing back to Julia.
So just real quickly to run through a little bit about, I guess, an overview of the Vaccine Ambassador Program, which is actually what this workshop has been funded as a part of. So both VADA and Pennington are a part of this program, just to provide an overview, and there are hundreds of other orgs beyond AOD through the mental health sector and other cohorts that are also being funded by the Victorian Department of Health, with the objectives of increasing awareness around the program, the vaccine program, increasing the confidence in talking about vaccines with others, identifying and understanding barriers or gaps in vaccine service provision, And for the AOD sector, specifically promoting pathways to vaccination among AOD service users and people who use drugs or people who inject drugs. So VADA and Pennington have been cooperating on our parts of this project to hopefully reduce duplication of resources. As people mentioned, there's so much already out there, and also to leverage each other's ideas and capacity as well on different topics. So I'll provide a brief overview of some of the other initiatives that have become available through this program. So starting with a bit through VADA, this project started in September, and we consulted with over 300 AOD workers across various networks. So managers, youth workers, nurses, general AOD workers, with the main findings that there were challenges in reducing barriers to access. In terms of discussing vaccines, that the values of trust and that openness were really, really key. And also a really strong demand for concise, consolidated, and centralized access to information, both for service providers and for their clients. So in result of these initial consultations, we enacted a couple activities through the end of this year. The first is a page on our website, which has started to organize a bit more targeted information based on the requests of service providers specifically. You'll note some of this stuff is AOD client specific. Some of this stuff is just quick links to department websites, so you don't have to go through those 30 tab click sequences to get to where you were hoping to find. And there's also feedback here. So if yourself or even your clients had any ideas as well, in terms of making vaccines accessible for AOD clients and people who use substances especially, we would love to have ongoing feedback. Beyond the website, we also had a couple of email signature banners designed, which are accessible on the website and welcome for any AOD service provider to use. Leaning on that aspect of you don't have to change people's minds today sometimes. And sometimes having that vaccine signature banner where they can click on it, maybe they had that conversation with you a month ago and they see it in your follow-up email, and it doesn't feel like it's the focus of the email, but it's there and it's around. So that was one of those pieces, again, of looking at that openness and kind of gently promoting the topic. And then, of course, this workshop that we're all sitting in today is also one of our more hands-on training aspects of VADA's Vaccine Ambassador Program. This project is an ongoing project with more resources currently under development, always looking to take on more suggestions and requests. You can send them directly to myself at jdaly@vada.org.au. And I am happy to note that this project is ongoing, and we've just gotten the announcement that it will continue through June 2022, where we initially thought it was going to end in December. So we'll actually have a bit more time and resources to put into, especially noting AOD clients will start to be eligible for booster vaccines in the upcoming months. So this project will go through that, hopefully to provide supplemental targeted resources through that. And then, as I'll note again at the end, this will be a feedback survey at the end, and your input is greatly, greatly appreciated. I endeavor to make all of this information as from the source, from the clients, from the service providers as possible. And the best way to make that happen is getting the feedback everywhere possible. On the flip side of that, a couple of things I'll run through real quickly with Pennington's Vaccine Ambassador Program. So for those of you who haven't worked with Pennington, they do a lot of work with the needle syringe programs, focusing on often people who inject drugs and other harm reduction programs. So they had very similar stakeholder consultations, with one of the biggest feedbacks from service users being that they wanted accessibility. They wanted to be able to walk in. They didn't want to make another appointment that they had to keep in their book and such. They wanted to be able to show up then and there and get their shot when they had decided, not when ambivalence came back. NSP workers specifically were really looking for those talking points, those conversation starters. Like, how do you jump into such a hefty conversation? And And also looking for those seeking of personalizing conversations. And that was kind of feedback that started to be a bit successful, kind of that solidarity. Pennington's also created some posters and stickers with QR codes that actually link to a webpage that they've created with the places that you can get walk-in vaccines. And so if you've been to the department's website, you'll note that they do list all the pop-up and walk-ins, but it's a bit confusing to just filter out exactly which ones you can show up to today. So part of Pennington's vaccine project has been specifically that aspect. And also looking at some more targeted talking points and specifically around things around, again, this booster shot, making sure people get their second shot, because they noted a lot of people get their first shot and then the priorities fall way lower after that first shot. And then both Pennington and VADA have been looking at the details around rapid testing, Medicare card challenges, proof of vaccination, and we'll be seeking to have more information on that into the new year. Here's just a link to the Pennington, a little snip of the website there. I will send these links out in an email to all registrants, so don't worry about quickly penciling down all of these details right now. And also on their website were some more talking points and basic fact sheets designed in partnership with Harm Reduction Victoria as well. So as you can see, a lot of collaboration, hoping to seek as much input as possible on these resources with a little bit of an AOD tailored tone to our discussions. And again, on Pennington's side, it is an ongoing engagement for them as well, and they are always seeking feedback. Melinda Lucas is the lead of Pennington's project. She's an apology today as she had a clash in trainings, but her email is up on that screen, and specifically around NSP workers, harm reduction, and that aspect of, I guess, vaccine promotions. If you want to reach out to Melinda, feel free to. So that's a bit of a brief whirlwind overview of what is available right now in terms of, I guess, resources for you guys to increase your confidence in talking with clients and your understanding of what's out there to support you in talking with clients. I do have someone from the department who should be coming to talk a little bit about what resources they have available to reduce barriers to accessibility. But I note they might be running a minute late. If Helen wanted to jump into the next part of her slides, I'll try and find her.
Well, just to alert you that I've put the handout in the chat. So you may just want to download that while Julie is working out what's next. And I'll just put those questions back up. So you may want to just start thinking and I know my section was a very bullet train ride through what MI might have to offer. Could have been a whole day workshop, a lot in there that we could explore and go into in more detail, but you might just want to start by just reflecting on something that you liked from what MI might have to offer, something that you learned, something that you might want to try when you're back out in those conversations. So you might just want to take a moment to reflect on that. And we'll also get some small group conversations in a little bit as well. So you can just kind of get your heads together, because no one approach is going to fit everyone. It's more about having a flexible range of approaches that you might find, oh, this might be a good fit with this person. This feels like it's helping us to have a better conversation or a more engaged conversation or less friction in this conversation. Handing back to Julia.
Thank you. And I guess while you hold that in mind, I am very happy to introduce to everyone Alicia Stark, who is the Director of Engagement and Partnerships for COVID-19 Vaccine Program at the Department of Health. Alicia is here with us today to speak briefly about some of the initiatives the department is running to currently reduce barriers to access to vaccines. So I guess without hesitation, I'll hand over to Alicia.
Thanks, Julia. And I've just got a couple of slides I'll pop up on the screen as well. So just bear with me one moment while I share my screen. Right, and just seeing, I'm checking that people can see that in presentation mode.
Perfect.
That's wonderful, great. Thanks very much for having me this morning, and really keen to sort of chat through where we're at as a program, and then happy to take any questions if that works as well, or anything on notice that I can bring back to this group around the current initiatives. So we've sort of presented a couple of times throughout this year to this group on the sort of delivery models that we've been using to get people in the door. And we obviously started with the sort of the broad brushstroke, you know, high volume sites. We have GP practices. We now have pharmacies on board as well. We've got community health. And then we start to get into the really micro of the system where we're utilising things like pop-ups, mobile vans, in-home vaccination, case management support, which I'll go through in a little bit more detail, that really helps us access, I guess, not only broad numbers of the population through high volume models, but then also that one-to-one hard to reach approach as well, to make sure that everyone can access a vaccination, whether they are able to walk into one of our high volume sites or they're homebound and they actually need someone to come to them. This gives a little bit of an idea of where we're at in terms of the amount of available pathways for people at the moment. So we were at a point at peak where we had over 2,000 access points in Victoria for vaccination. We're currently in the process where we're consolidating some of the state-run fixed sites and really bolstering our partnership with primary care to make sure that people do have a lot of options, and then obviously ramping up those sort of one-to-one case management pathways for people who are still yet to be vaccinated. Just reminding people that we're still able to take bookings over the phone and also online. Over the phone, people will be able to access different supports as well, like access to taxi vouchers, if that's a barrier to being able to get to and from their vaccination appointment. They can also access a DLO by going through the call centre. They can access the Aboriginal and Torres Strait Islander info line service from next week in partnership with their vaccination appointment or questions as well. And there's a range of other supports that are available by utilising the 1-800 number as well. There's obviously a whole range of support available for persons who identify as Aboriginal or Torres Strait Islander. As I mentioned, we've got the Aboriginal info line, which from next week will be scaled up. We've partnered really heavily with ACOs this year. There's also a range of mobile options for members of this community as well. And there's priority access at all of our sites too. So just a bit of a reminder on where we're at with second doses. So in terms of the interval, we still recommend 3 weeks for Pfizer, 4 weeks for Moderna and 6 weeks for AstraZeneca. But probably the big piece that's sort of at the front of everyone's minds at the moment is around boosters, which we're looking at their third doses for persons who are immunocompromised, and then boosters for the remainder of the population as well. The reason that we've split that out is people who are immunocompromised, we're really encouraging to come forward to maximise that level of immunity. Those for boosters, we're recommending they come at a 6-month interval to come forward and top up their dose. So we're now really talking about the COVID vaccination as a 3-dose schedule to really maximise immunity and keep yourself and the community safe. Currently, we're offering Pfizer as the booster dose. So regardless of what your first and second doses were, you'll be able to access Pfizer as your booster dose. That's available through our fixed clinics, through GPs, and now pharmacies are starting to roll out Pfizer as well to really support access for boosters for everyone in the community. Now, just touch on a few of the sort of additional services and programs we've got running with the vaccination rollout. So the first one that is really, really widely utilised is the Disability Liaison Officer service. So it really helps people who have a disability or may have complex or additional needs to access essentially a case manager who can link them up with a pathway that's suited to their individual needs. So it may be that they need a disability specific fixed site. So we have a range across the state, including some that are low sensory spaces. So a disability liaison officer would be able to help that person or their carer or their family to link up to an appointment at an appropriate fixed clinic. They can also help people access primary care pathways like a GP or a participating pharmacy. And they can also really support people to access the vaccination in home service, which launched in its fulsome a couple of weeks ago, though we have been offering it for people with a disability for probably 3 or 4 months and has had a really good uptake. To access a DLO, there's a few pathways. You can use the online form that's available on our website. People can direct email the DLO coordination inbox, and they can actually also access the DLO pathway through the 1-800 number as well. The COVID vaccination at home service, as I mentioned, we've really strengthened over the last few weeks and is now being rolled out by our health partners or our health providers statewide. Essentially, it's for anyone who requires a COVID vaccination in the home. So they may be homebound, they may be a person with a disability or a chronic illness, or they may have just had no other way of accessing vaccination to date. We had a really great example last week in the Barwon region where we had an 82-year-old whose wife was actually housebound due to severe mental illness. He was the primary caretaker of his 2 adult children who had a disability as well, and has just not been able to find another way to access vaccination. So he was able to have the vaccination at home service come out and vaccinate him in the home where he was needing to look after members of his family on a full-time basis. So essentially, to access the vaccination in the home service, we currently go through the 1-800 hotline, and for the most part, whether you're metro or regional, most people are actually able to access a vaccination in the home appointment within a week at this stage, and they'll do a first or second dose. And we're currently scoping up what it looks like for booster doses over the coming weeks as well. So people will be able to access their Pfizer booster dose in the home as well. Again, we can have the disability liaison officer support this process. So for some individuals, their needs require a disability liaison officer to be with them at point of vaccination. So that does extend into vaccination in the home if they need that support on the day as well. One question that comes up a lot, and we really do like to stress in all of our conversations, is, you know, how do I book if I don't have a Medicare, if I haven't registered for an IHR, if I'm undocumented, and I don't have any of these details? You can be vaccinated anywhere in the state without, through any of the state-run services without an IHR or a Medicare card. Some general practices do it, but for the most part, they're unable to, because they're not able to then able to bill for the service. But certainly all of our community health services and all of our fixed clinics and our vaccination in the home service is accessible to any person, whether they've got an IHI or a Medicare card as well. For the most part, we do ask that people bring identification with them to their appointments, but again, it's not possible for all people in the community. So we will vaccinate even if someone doesn't have ID with them. And around accessing a digital certificate. So again, it's been a really topical issue over the last few months. Digital certificates will link back to someone's immunisation register. So through their MyGov, they can access it. If people don't have access to MyGov, they can ring and actually get a paper copy sent out. And then there's obviously the Services Victoria app for people who want to be able to link it to that and use it as a proof of vaccination when checking into hospitality or retail or events. And just a few takeaway messages. So we're currently at over 7 billion doses worldwide for the COVID vaccine. Vaccine safety is something that we are constantly refreshing and monitoring and updating with the most recent evidence that's available. Those safety issues have been talked about quite a lot in the media, and people are quite concerned about them. They are rare. And we really recommend people talk to a GP or a trusted health professional if they have personal circumstances or concerns or further questions. And that we really do stress around the sort of the media headlines that they are often misleading, and we do really stress people to use trusted sources of information for further information about the COVID vaccine. I'll send this around as a PDF after this session. There's some great links in here, and there's also a really good video around the work we've done in the Aboriginal and Torres Strait Islander space. So we won't go through these now, but that's all in terms of my presentation. And I will just stop sharing so I can see everyone. And I'm not sure if we wanted to do questions now. If there's time, I'm really happy to take anything.
We've probably got about 5 minutes if anyone had any questions pressing.
I definitely recognise some of the challenges at the moment in the, I guess, the Services Australia space and people's certificates. What we are hearing from the Commonwealth, who sort of looks after that Medicare platform and the certificates, is that there are fairly lengthy wait times in terms of having some of these records rectified. So I do ask that you be patient, but recognise it's really frustrating when people need to use it in order to get into a store or a restaurant, and through no fault of their own, their certificate is actually incorrect. So I'll see what I might have that I can send around after this that might make it a bit easier to find information. But unfortunately, when it comes to the Medicare record side of things, I don't have much that I can offer in terms of some solutions, and recognise it can be a really painful process.
Other questions? Feel free if you had questions on the stuff I had flagged about the vaccine ambassador activities from VADA and Pennington as well. Happy to take those on. Otherwise, I won't make you sit in awkward silence for too long. Alicia leaving this meeting doesn't mean it's the last point to ever ask questions and that door closes.
No,
if you
we're
have
an open book.
So if you have questions, you can pass it on to us, or Alicia, is there a contact detail in that presentation as well, or would you prefer that people pass it on to me?
I'll send that. Might be easier. Yeah, I'll send it to make sure it's in the PDF that comes around, so you've got a contact to either myself or Hayden.
Perfect. So beyond there, I'll probably excuse you if you want to step out, Alicia. Thank you so much for popping in and providing that brief overview and the in-home vaccination announcements. I've been very excited to hear those.
Yeah, it's definitely growing traction. So certainly spread the word around, because we know there's a lot of people out there who it's just impossible for them to get out of the home and access something like a vaccination appointment. So being able to offer this is it's really exciting.
Excellent.
Thanks so much, everyone.
Thank you.
Bye.
Take care, and I'll pass things back over to Helen, and she'll probably bring us back to those last few questions for, I guess, a 10-minute reframe, wrap up, and reflection.
Yeah, because one thing we were thinking of whether you wanted just a few minutes just to chat with each other, to go, what sense have you made from today? What do you want to take from the presentations? What does this mean for your work? So we've maybe we could have just a 5-minute small group if that would be helpful, and then just finish with, okay, where's this leave you? Where are your thoughts? What's been helpful? Where to next for you? How's that sound? Just a quick check-in with each other, just to process. Is that? It's always hard with a bigger group. Some people heading off now. Maybe just 5 minutes or even less. Actually, no, we are running short of time. Maybe let's just do the check-in questions, because it looks like a few people are now beginning to drop off. So I guess just what was helpful from the session? What are you taking from this that might be adding to your skills, tools, ways of approaching these quite challenging conversations. What was helpful? What was maybe something that you liked that you heard from the whole webinar?
So just to wrap up, I just want to thank everyone for taking time out of what I know is very busy schedules for everyone right now to have the open conversation and explore some things a bit deeper. I hope you found some of the information today valuable. Anything we can do better, I know feedback and surveys and such. I don't just want to hear what we did well. If there's anything we could do better, anything that you want more of, please do let us know. And many thanks to Helen for coming today and presenting as well. It's always a pleasure hearing your presentations, I'll be honest. It's a bit of a guilty pleasure of mine too. So I hope you all enjoy the rest of your day, and hopefully we will see you in the new year. Alrighty, thank you everyone.